Hello, Harry Brownlow, Berkshire Shoulder Specialist. Today I want to talk to you about issues regarding consent for cortisone injections. Cortisone is the same as steroid. We often use injections, particularly around the shoulder. We might use it because we're trying to work out a diagnosis. So for example, if we inject a very particular part of you for a specific diagnosis and yet you don't respond positively, then that's a good way of ruling out that particular area as the source of your pain. But more often we're going to use an injection because we have a good idea of what the problem is and this is going to treat it. Cortisone is a very powerful anti-inflammatory agent and is very good at reducing inflammation and therefore relieving pain for lots of common shoulder problems. But it's not without potential risks and complications, and that's what we're going to discuss today. So the first thing to talk about is the fact that it might not work. So the reason why it might not work is either because it's been put in the wrong place or because the presumed source of your pain is not correct. Now, it's very unusual for us to put the injection in the wrong place nowadays because I certainly give all injections under ultrasound guidance, and that ensures that the injection is put where I think I put it. So that is, in what I believe to be the right place. If you don't have a positive response, it must therefore mean that the problem that I thought I was injecting you for is wrong. Now, while that's disappointing from your point of view, actually it can be very helpful from my point of view because shoulder problems can be complicated and it might sometimes take a little while to work out exactly where your problem is coming from. But the second thing to discuss is infection. Infection after cortisone injection is incredibly uncommon. I've done them for years and I can't remember ever having had an infection. But it is a recognised complication, it can happen, and if your arm becomes increasingly painful, if you become feverish, if the wound goes red, then it's important that you seek medical attention to have that ruled out and treated. The next complication is allergic reaction. Allergic reaction is something incredibly uncommon, thankfully. If you've had a bad experience with a previous injection, perhaps at the dentist, then it's important that you let us know so that we can make adjustments to what we're planning to inject in an attempt to avoid you having a problem. But if you fear you might be having an allergic reaction, the commonest of which would be to have come out in a rash, or if the pain seems to be getting really bad, or you feel very unwell, then of course it's important that you seek early medical attention. The next complication is skin thinning and blanching. Skin thinning and blanching is where the needle goes in, the skin can become a little bit thin, and where the needle goes in, the skin can lose a little bit of its colour, so-called blanching. This is quite an uncommon feature of shoulder injections because the injections put very deep inside your body. This can, however, be a problem if you are having injection, for example, for tennis elbow, where the skin is very much closer to the site of the injection. And the final complication I wish to discuss is a flare. A flare is quite a common thing. So quite often an injection, for example, put into your AC joint, close to your skin, can cause a nasty flare. And by that I mean the pain gets very much worse for 2 or 3 days. Now, while that can be quite alarming, it's not serious, it doesn't mean anything bad has gone wrong, and it will settle with simple pain relief. It's perfectly safe to take simple pain relief. There's no problems with any interactions with any of the drugs. If you haven't been warned about the potential risk of a flare, then you might fear that something dreadful has gone wrong, but it almost never has. It's just this little flare and it will go away. It's idiosyncratic. That means that one time you have this injection, you may get this horrible flare, and on another occasion you have the same injection and nothing happens, and we don't understand why there is that distinction. So thank you. Those are the main complications. By and large, injections go without problem, without complication, and are almost always very successful. Thank you.